Good afternoon. Today I'm joined by, you'll see a team of members of the Communities of Concern response team, as well as members of our Medical Reserve Corps. Today, while we focus on the numbers to start, we will also give then a little kind of segue into the important activities and the work that this is doing. Because I really want to come back to, it takes a community to respond to a pandemic. It takes a community to recognize, it takes a community to understand what they need to do, and it takes the work of community volunteers to support us in this efforts. So as of today, we are reporting a total of 124 new cases. And again, I know people are concerned as we look, how do we get to the Restore Illinois metrics if our cases are increasing? But 56% of these were from the backlog of the test results from the community-based Triple T site at the University of Illinois Health Sciences campus. So these are results going back as far back as April 26 up through May 6. So we continue to receive those results through coordinated efforts with the Illinois Department of Public Health. So again, as we begin to look at this, we expected those numbers as they came through to roll. Our total case count now is 1,303. Our positivity rate is still hovering around 15% at 15.3%. And today we have no additional deaths to report. And I want to remind people that as they look at that daily report, if we're not in a briefing day, that deaths don't all come in one day. If you see a spike in number, look at the date of the death, because oftentimes we're waiting for those death certificates to be filed. It may be that they require an autopsy. So it's not a sudden death, that occurs on that day. It's really over a period of time. So be mindful as you read these reports. It's really just to give an overview and a picture. It's over time. It's not necessarily one thing that's occurring on any given day. Our total deaths remain at 39, and again, we mourn the loss of our community residents. As of today, over 13,000 tests have been conducted, representing just under 5% of our population. So I really commend the community who's gotten the word out about the importance of testing, and you'll hear a little bit about the work of the Communities of Concern and the work that they've done to make sure that some of our communities at greatest risk are also getting tested. But I also want to highlight today, as of today, over 1,500 contacts have been made with those who were tested through the community sites by the local health department. The 17th Judicial Circuit Court staff that was highlighted yesterday in the Rockford Register-Star, and the Medical Reserve Corps. And I come back to this. As a health department with under 100 employees, we would not have been able to mount this level of response without the support of the Winnebago County Medical Reserve Corps. And I often get asked about what that is. First of all, it's part of a national network of volunteers organized locally to improve the health and safety of communities. Volunteers are recruited throughout the year, not just during pandemics. So oftentimes you will see our recruitment activities at the county fair or different outreach activities. And the idea is to sign up to respond locally. We developed, and the Winnebago County Health Department established a Medical Reserve Corps under the director of the Public Health Emergency Preparedness. We felt that was an important activity, and we've had one for over 5 years. Currently, we have 152 volunteers who have stepped up to assist in the response. Today, you're going to hear about 2 response activities that Medical Reserve Corps volunteers are actively engaged in. One is contact tracing. We've heard a lot about that. We refer to it also as contact investigation, but contact tracing, and you're hearing about that's one of the national metrics that we have to be able to meet in order to move forward into the next phase, and outreach into communities of concern.